we'll just start with literally just chatting about really just kind of the reason you were started on CBD and THC, and then we'll just talk about some of the symptoms it's helped with, and but just real casual, so nothing real like formal. It's just like a conversation between me and you.
Okay.
So with that in mind, why don't we start there with what you were started on cannabinoid therapy for?
So me and a girlfriend had seen you speak at a library, and I can't say for sure, but I think one of your first comments where who wants to get on the floor and play with their grandchildren and who can't do that?
Mhm.
And ever since I retired about 11 years ago, I couldn't get on the floor. I was one of those ones. I didn't have the grandchildren yet, but I could not. I got on the floor, I couldn't get back up.
Yeah,
And just aching, just everything. And so from then on, I came to see you, and it's a whole new life now.
good, good. And so when we were starting out initially, what was kind of the reasoning for being unable to get on the floor or being able to move around? Like, what was the condition or the
So,
reason for that?
yeah. And I think it was inflammation,
Mm,
like of my joints.
yeah,
I just ate all the time. Even before I retired, I would drive about half an hour away. By the time I got home, I had trouble getting out of the car. I'd have to stand there for a few minutes to bend over to get my purse. And it was like, I feel 90.
yeah,
And then if I got up in the middle of the night to go to the bathroom, I was always very nervous because I was so seized up. I thought if my house caught on fire, I'm not going anywhere. Like that's how bad it was.
yeah, yeah.
And then the sleep also. And I think they might go hand in hand because I'd sleep only 3 or 4 hours. And being retired, it was like not a big deal. I'll just lay down for a nap. Well, that's not the way I wanted to do things.
Yeah.
And so you ended up helping with both.
Good, good. Well, I mean, obviously, love hearing that,
Oh man.
and
Amazing.
I think that is kind of you hit the nail on the head where we were helping with pain, and then yeah, maybe just go through again for sleep. So sleep was one of the big goals, right?
It really was. And again, I think they might go hand in hand, but I would wake up at whatever reason, 2 o'clock, go to the bathroom, whatever, and never go back to sleep.
Mhm.
And so I always felt like I was behind. I would try to go to bed early, and that never made a difference. And so I was only getting 3 or 4, and then hanging out with my girlfriends in the afternoon and wanting a nap.
Yeah,
And so
yeah.
it was not a great life.
How much sleep now are you getting compared to before?
Oh, wow. Solid all the way through the night, not even waking up to go to the bathroom, at the very least 7 to 8 hours, if not 8.5, a little bit more.
Oh, amazing. So going
Yeah.
from 3 or 4 hours to 7 or 8 hours,
Yes.
and
Huge.
huge, huge. And so how does that getting that better sleep, what has that translated into during the day for you?
Oh, it just more energy. I was able to get out and do things, and then having the joints a lot better. Then the two of those hand in hand, I was out visiting, doing
Yeah,
everything you want to do on retirement. I tilting, I couldn't do that for a while because it was very hard on the joints of the cutting and all of that. And so I was able to pick up all my hobbies again.
right. Excellent. So yes to improving pain and sleep, but also you were able to resume some of these things like quilting, things you want to do.
Absolutely. Absolutely. And then I was so nervous. I now have grandchildren, and the oldest is 3. And for a year there before I started with you, I was very nervous picking him up. As a baby, not so much, but as a weekly toddler,
Yeah.
I didn't feel confident in my strength and ability to hang on to him. And now it's just, yeah, nothing to it now.
Wonderful. Wonderful. And then so when we hear that, improve pain, sleep, able to do some of the things we want to do again. What are your thoughts on, and this is why we're doing this, of course, but as far as seeing those benefits, do you think cannabinoid-based medicine should be covered by insurance companies and by our government healthcare plans?
Absolutely. It is shocking that it hasn't. I mean, I can't be the only one doing wonderful on this stuff. Like, why isn't it covered? It is ridiculous. When you're a pensioner,
Mhm.
live by yourself, like that's really hard to cover that. And any of the over-the-counter or any prescription I was given for my pain and my sleep always had side effects. So this has no side effect. It does the job and they don't cover it. But the others, the horrible side effects of ibuprofen, and it goes on and on and on, and yet the government covers that. It's just not right. They absolutely need to cover everybody, not just pensioners, but it really would help us.
Yeah, absolutely. Absolutely. And what were some of those medications? You mentioned ibuprofen. Were there any other ones that you had tried and, maybe didn't see the best results with or side effects or anything like that?
Yeah, yeah, definitely. Eventually, I was on a strength ibuprofen.
Okay.
To, and I was so, and I also took a lot of Tylenol. And so I was very nervous about, I know one of them affects your liver and one affects your kidney or something, but I was on it every day, 2 to 3 times a day. So my
Yeah.
stomach started to have some issues and I just knew that they weren't really safe.
Yeah.
But if I had to get up and pick up a baby, I needed to have something.
Right. Right. And have you, with your ovarian CA diagnosis, like anxiety along with that, did you find, just curious too, like, did you find it helpful in dealing with that news? Like, or is it really been more of a benefit from and this is just me kind of talking now, like more from a pain and sleep side of things, or was there some anti-anxiety effects going on as well?
I think so. I mean, I never thought I had anxiety or a bit of depression, but going through some of the health things, looking back, I think I did.
Mhm.
And I think it just relaxed me, or getting enough sleep helped me deal with other medical issues.
Yeah.
Um, yeah.
Yeah. And do you mind telling people like what medical issues you were going through? Because it is remarkable, your strength and how
Yeah.
you got through things.
Um, yeah, just I had ovarian cancer in 2008, had some surgery, and then was going along just fine for 10 years. And now, of course, it decided to show up again.
Mhm.
And so it happened at the exact same time as COVID.
Right.
So therefore, I couldn't go in for my biopsies. I couldn't go in for any tests. Everything was kind of on hold, which stressed me out just incredibly. And I really do think this made a difference. Getting the proper sleep, at least being able to get up and start moving around. And now I'm starting to use it for some nausea that I'm having for some other cancer medication. But I'm hoping that's going to have a big effect.
Yes, yes. But it's so interesting, talking and thinking, okay, so here's a medication that can help with sleep, can help with pain, can help with anxiety, can help with nausea, right? As opposed to
No
taking four,
brainer.
you're right, taking four different medications.
Yeah.
Just
Every single one of them had still have horrible side effects. The chemo pill I'm taking makes me nauseous. The nausea pill I take makes me constipated. Then the pills I take for constipation, like it just rolls around,
yeah,
and I can get it all from you
yeah,
without side effects.
ah, yeah. Well, I'm happy. Again, I'm just happy to help, of course. And
So for
so
sure.
perfect,
So
perfect.
what do you think the chances are of the government ever, or like, I mean, we have an election coming up. Does that have anything to do with it?
you would hope, but there's so many other storylines in the news that like something like this, which
Yeah.
is so necessary for so many people, even our dementia patients, our kids with autism,
Yeah.
of course, all of our patients that are going through chemotherapy or any kind of cancer diagnosis, it is a no brainer that they should have this covered. But unfortunately, it's not really in the news.
Yeah. Yeah, you're right. This is really bad timing with a lot of things happening. No, that
Yeah.
makes sense.
But and that is exactly why um, we're doing what we're doing right now, and doing this, Sandy, is that hopefully we together, you, I, the rest of our group, we can raise enough awareness that this gets on the radar for people. So
Oh,
thank you for taking the time.
oh, well, thank you. Believe me, thank you.
My pleasure.